Welcome to Medical Confessions. Today on our docket is leeches and how they're used medicinally. So not only current, which seems to become more popular, but also a little bit of history, maybe?
Yeah,
So,
a little bit.
what is the deal with leeches?
Yeah, they work for a lot of good things, but they used to be used for randomness. There used to be a thing called four humors, and the Greeks and the Romans.
Those Greeks.
I know.
Yeah.
Geez, all their gods and stuff, and their humors. But one of the things I read for how they used leeching for was people who were excessively happy. They would leech them.
You'd be leeched.
They have leeches everywhere. So no, there's these four humors, right? And they were based on the fluids in your body, and it was like black bile, yellow bile, blood, and phlegm. And so if one of and inside your body, all of these fluids have to be maintained in a certain volume. And so if one was out of whack than the other, they would try and fix that.
Yeah.
And so blood being one of them, they would use leeches to reduce the amount of blood, thinking that it would fix stuff.
So what would they use for the others?
So. Well, that's a good question.
And black bile, how did they clear that one up?
Oh, yeah, that's gross. I don't know. Like, what, black bile?
I mean,
is that like GI bleed?
It has
bile?
to be, right?
Or, I mean, what is black bile?
I don't know.
Fun fact, did you know leeches can consume 5? Well, I read 5, and then I read another study that said 6 to 8 times its body weight in blood.
Mm-hmm.
Isn't it still only 15?
It's 10 to 15 milliliters is what they can do in a sitting in about 40 minutes, which is a lot. Cause
For a little leech.
I feel like a human leech.
I thought of you when I read that.
No, I can consume a lot of food.
Yeah, that I agree with.
I really did think you came to mind. Like,
Human leech.
Gentle leech.
I just think it's interesting, though.
Well, yeah, so this four humors, when they're trying to fix this blood, there was this thing called sanguine, or sanguine, however you want to pronounce it, and its term is excessively optimistic when you shouldn't be optimistic. And,
Wow.
and the redness that they would get from that, and they would think, leech them. And I'm like, really? Because somebody's really happy? Because it's medieval times and you shouldn't be happy all the time?
It has to be like the time or something.
Just a bunch of people walking around pretending they're sad.
Yeah.
Don't leech me.
Or would they want to be leeched? Is it painful?
I've never had a leech. I don't know. It shouldn't be painful. I mean, they have molecules in there that are analgesics, and that's actually why we're using it in medicine
I
now.
don't think they're painful because you always see, I told you that my sister got a leech. A couple of them. We were in a little lake near our house growing up, and she was swimming and never knew that they were on her. It wasn't until we got out that these leeches were stuck to her body, and it was only then that the panic ensued. But you've seen the movie Stand By Me?
Yeah.
Same thing. Leeches all over, but they didn't know till they got out, so it must not hurt to be leeched.
Well, no, they have an analgesic in there that helps. There's about 60 different molecules, or 20, depending on who you read, somewhere between 20 and 60. But so the analgesic stuff is, like eglin and antistasin is the molecules that are in the leech's saliva that is kind of an analgesic. And on a side note, do you guys want to test? Because you guys never listened to me, so I'm kind of excited about this one.
Okay.
Because we just did this episode 3 episodes ago. Transient receptor protein vanilloid class. What were we talking about? You should know what we were talking about.
Shoot.
Because it was visceral for you, and that pun is very intended. The capsaicin. So that's the class of protein that
I actually blocked out that whole episode.
Anyways, so leeches have that. That's anyways. It's one of the analgesic things.
I still have side effects from that. If I go several hours and don't eat, my stomach starts burning really bad.
Oh.
Wow,
Yeah.
so you've got a little stuck in your small intestine somewhere?
No, I feel like there's a hole there.
It's
If I
it's Jen's reminder to
it's
eat.
necrosed your tissues.
Yeah, I feel like it. Yeah.
Well, it
Anyways,
can at high enough. It was a ghost pepper.
Yeah.
You might want to
Yeah.
get that looked at.
Somebody I know was I was like, oh, it's been hours since I ate. My stomach's burning. It was from what? From that habanero you ate? And I was like, it was a ghost pepper. I want full respect. It was a ghost pepper that I ate. Anyways, go back. Go. Digressed.
Yeah, no. So leeches in their saliva, the ability for them to just suck out blood requires quite a few things to happen because our body naturally will want to stop bleeding. So They've got a few different things. At first, they need to create a path for the blood flow, so they need to degrade the matrix that is your skin.
They have a bunch of little teeth, like a shark, right? Like
they do. So they've got 2
teeth.
mouths, one on each side. One is more for like stability, and the other one's for the eating. And they actually have, it's like a upside down Y shape, and then they've got tons of teeth and actually break hippo skin. These little teeth.
Hippo skin.
Yeah.
Oh.
Crazy.
That's strong.
Yeah.
Seems like hippo
skin.
skin's pretty tough.
All the hippos that you've come across.
So they need to do that. That molecule is a collagenase. They need to increase blood flow, so they use acetylcholine is in their saliva. They need to inhibit the platelet formation, so those clotting factors, and so calin is one of those molecules, and there's tons of them, so we're not going to hit every one, obviously, but then they need an anticoagulant, so hirudin is the molecule for that.
And that's actually the term they use when they talk about leeching.
Yeah.
Isn't that right?
Correct, yeah.
Hirudin medicine?
Yeah.
Okay, yeah.
And that's the main molecule that keeps your
Right.
blood from clotting and is what's keeping you bleeding basically for up to 10 hours after the leech comes off. You get that small capillary bleeding, which medicinally is kind of what we want. And then that analgesic effect, so that the thing doesn't know it's attached to them. So it's kind of what do you call natural selection thing, and that's that eglin.
So I'm just thinking about
anti-stem.
those people that are on blood thinners that get these little skin, not tears, but the little bleedings that they get. They're on blood thinners so they don't stop bleeding.
Yeah.
Could we just keep a couple of leeches on hand and throw a leech on it?
Well, it'd make it worse because they're not bleeding because of the.
Don't they have the
heparin.
anticoagulants?
Yes. So you're saying you want to stop the bleeding,
never
right?
mind.
Yeah.
Dang it.
Not make it worse.
Dang it.
Yeah. So there's 14 different.
Wrong way.
There's a ton of clotting factors, and they all work very
Yeah.
differently. So aspirin's different than heparin. That's different than
Okay,
Plavix. It's
now I'm
different
following
than.
you.
It's just a clotting factor.
Okay.
That it's inhibiting, and in this particular case, it's anticoagulant is this molecule
Okay.
versus like a
Now I'm following you.
heparin or a Coumadin or something like
Right.
that. But you
I
don't
like
want
how
to do
when
both.
we see really stupid things, Scott will dance around in his verbiage to make
He's
us
so
not
nice.
look as stupid. He's like, what you meant was. Anyway. That didn't work.
So it is all of these molecules inside the leech's saliva that now we currently want to use for medicine. Back in the day, they're trying to cure humors, and they didn't really know what medicine was, and they didn't have
Right.
evidence-based medicine. They were just guessing, because drilling holes in heads was a thing. I mean, that's never
Yeah,
a good
I remember reading
thing
about that.
ever.
Yeah. Well, it is a good thing at times. What if you're hemorrhaging? They don't
You
do
should
that?
never drill a hole in your head.
Really? Don't they
Yeah.
remove parts of your...
Well, for ICP, but not that's an emergency treatment to keep ICP down. But again, that's kind of last ditch effort. They use a lot
Right,
of
but
other
does
things.
it save lives?
Well, if you're actually at that point, you're probably not going to make it anyway.
does.
So
It does.
there's
It
one
is,
life.
there is a use.
So in the history of humanity, drilling a hole in a head saved one person.
Somebody.
I don't know the numbers, but you shouldn't drill a hole in your head,
Okay.
generally speaking.
Next time I have
ever.
intracranial pressure.
There's
I
a
won't hit
podcast out
you.
there. Sawbones. That's their main theme is saying don't drill a hole in your head.
Oh, is it?
Yeah.
Okay. Fine. Because I like them. So fine.
Have you listened to that?
Yeah,
I
yeah.
love them. They're so funny.
Yeah.
I wish we were as funny as they were.
We're not.
We're not.
We're also not as smart.
No.
Most of us, anyway.
No, we're not. So because of all these properties that it has, right? It's going to increase your blood flow. It's going to, anticoagulant stuff. So it can be used medicinally for a few things now. So like amputations, it's great. Like finger amputations, you stick a leech on the end of there, start sucking that blood, and you get those, capillary beds that want to repair themselves. So you get better blood flow. So you get better reactions. Neuropathies from diabetes,
Right.
there's blood flow issues to those small capillary beds. Stick some leeches on there. If you do skin grafts, same
Yeah.
thing. And then they've actually been using that analgesic properties for osteoporosis.
I saw that. That one kind of
Um,
surprised me. Well, the other ones that popped up that were interesting to me was the hemorrhoids. I want to know how exactly you apply. the
It's
leeches.
like a
when
caffeine
you-
suppository.
I don't know, but like that treatment sounds horrible. Like, at what point do you just lay on the bed?
Well, and you can see
let
what
them
they're trying to
apply.
do. They're trying to get the blood flow out of the inflammation out of that pile. You
Right.
know?
Pile.
And well, it's a pile, right? Because
I know,
everybody
but
has
no,
tendons.
I get
it's the
it.
name.
I
It's,
just
it's
like-
funny. Well, and then the other one that I thought was interesting that
We
they
know
also
what it is.
that they also referenced was varicose veins, and I was
Uh-huh.
wondering how that, do they apply it on the outside of the skin, and then
That's
Just-
a good question. I
yeah.
don't know too much about the
and I
varicose
couldn't
vein
find
treatment and
anything
why.
that explained why or how it went, but
I didn't look that one up. I don't
yeah, that
But-
one's interesting.
Fun fact: leeches are hermaphrodites.
know. They are. I saw.
Are they?
Yeah.
Which
That's interesting.
I think is super exciting.
Yeah.
And they've got like 34 or 32 brains, and they're segmented it off into 34
What?
segments. Yeah.
And
Now by
they're
brains, you're
worms.
talking about the neurons in
Yeah.
each different section.
Right.
And actually, we used leeches for in studies for different neurological disorders because their brain is very similar to ours, or their brains are very similar to ours.
Grasshoppers too. They use psychoactive drugs to test on grasshoppers because they're
You see grasshoppers all K-holed out on ketamine.
I have a
just
whole
flying
list. I have a
around.
whole list of insects that
Are
used
useful
for
in
different
medicine?
things. Yeah.
Oh, really?
Yeah.
See, I like that because I think the only one that I had always come back to was maggots. Like, I
Yeah.
know that
Mm.
maggots are used for that, and I have one of my best friends' family had a maggot farm growing up, and they just sold it recently, but they actually, like,
Is there good money in there?
There's
oh
big money
man,
in that,
yeah,
yeah.
and there's different types. There's the type that you can sell for bait,
Mhm.
and they would dye them like yellow or blues
Oh,
or pinks
yeah.
and stuff, just like power bait, I guess. And then there's the, like medical grade, and that's a whole different process. Like, they have to, probably the same as the leeches, very,
Yeah,
very
okay.
clean and all that kind of stuff. But yeah, like they have a full on, in fact, they were on Dirty Jobs.
Oh, cool.
Oh,
Yeah,
nice.
yep.
Well, yeah, the FDA process to just be saying that that's medicinal, you can sell that.
Right.
That's a big process. It's a lot of expense to
Well-
do that, but at the end of the day, you can then charge a lot more.
Sure. Well, as a matter of fact, in prep for this, it sounds like we were all kind of on the same page, but trying to locate leeches, I was hoping to get some to bring
Yeah.
in. And I think April was doing the same thing, but the only place I could find them, and I looked everywhere,
Yeah.
was eBay. And it looked shady. In fact, I printed it out. It's 20 of them for $200. And I could have had them by Saturday,
seems like
June
a
9th.
lot for a
See,
leech.
and I found legit websites that sold them.
Yeah.
Because like
but-
Cabela's and those sell them.
No,
Leeches?
no, they don't. I called them, and they
Online, they led me to believe they sell them.
they have what's called Leech Live or Live Leech, and it's actually a rubber leech. I thought it was a
Oh.
live, but and then
It's
when
not.
I called, I asked, and they don't. Because
Well-
We were all calling at the
Yeah.
same time,
Yeah.
and they're all like, what is going on?
Why do these people want
the same
leeches?
store.
yeah. And I also called. Well, Bass Pro Shop didn't open till 10, but
I think that
They
there's
have the
some
same
like
bait
black
as
market.
Cabela's.
Like, there is somebody with a basement, who's got this stuff like in jars.
Well, and the problem is there's about 600 different species of leeches, so which one are you getting?
and not
As
all
well,
of them
'cause some
suck
of them-
blood.
Well, and some of them
What
can be
else do they
poisonous.
suck?
I don't know, but they're not all bloodsuckers.
Well, and we talked about this a little bit before, and we stopped because our conversation was getting interesting. But why? Well, because sometimes we have really good conversations off camera, and it's a waste.
Yeah.
Nobody's there to witness, and then we get here, and it's horrible. But we were talking about, like, I was really surprised that there isn't a bigger market. Like, so with having farm animals and stuff, like, you can buy medications for farm animals that you can't buy for humans without a prescription, antibiotics and stuff like that. And then I know several people, friends that are, have
Disagreed.
things like goats and stuff like that. And they're actually very, I don't want to say veterinarian, but, by self-education and stuff, they become quite,
What would you
proficient
be
at-
treating that
I don't
would
know.
be your thing?
I'm
'Cause,
thinking like that there's not
are you
a
going to do a
market
skin graft on a goat? Or
I actually met a lady who used to drink like the deworming stuff they use for horses and stuff. Like,
she thought she had worms?
She did have worms. Like, she had like little
Ringworm?
things that would pop out of her skin.
She had
like,
ringworm?
Ringworm.
She had all sorts.
I don't
of
know if
things.
that works on
Like, it was
ringworm.
gross.
It's
She tried also.
gastrointestinal.
She
She
tried
didn't
a
want to
bunch
go to
of
the
stuff.
doctor?
She went to the doctor and she said no one could figure out what exactly it was that she had. She'd been treated
Why
multiple
were you
times.
around this person?
I can't say.
Oh, okay. Well, I think what Scott is saying, because the question I posed to him was, why would there not be a market for medicinal leeches for
Because if your goat gets a
animals?
leg amputated, you're like $10 for a new one down at the store. It cost me $20 for a leech. I mean, it's just
Goats aren't that
cost-effective.
cheap. I've been pricing them out.
I know
A
the
good goat.
fainters are really expensive.
I know, and a good pygmy will set you back a pretty penny.
Yeah, $200.
But what my question though is like, what about? Well, I had a dog that impaled himself on his kennel and ripped open his side. Like I'm gonna say, 10 inches ripped open. My husband ended up stitching him up. But what if you have like a cow or something like that you didn't want to pay, and you had an open wound that was needing to heal?
So what are you trying to heal? The antimicrobial stuff from the leech? Is that what you're going to use? I mean, what is the leech going to do for you?
Well, I don't know, but they use them for after cosmetic surgery. Leeches do. They put them on areas that you're afraid of the tissue dying and stuff. So what if you were stitching
up? You're
up?
not worried about tissue dying with a cut because it's going to repair itself with scaffolding and scar.
Let's make up a really nasty cut. They put
talking
maggots in.
You're talking about surgery and amputation where you're actually changing the blood flow. Here in a cut, you're not really changing blood flow.
So how do they use it for cosmetic surgery?
So like if
Bruising, right?
Well, so let's say you need a tummy tuck or a facelift or something like that. You're actually cutting away portions of the skin and then stretching and pushing it down, so you're removing those capillary beds.
So what if you had like a big tear,
beds.
like on a cow's side?
So you've avulsed
the
entire side.
Yeah, not a laceration, an avulsion.
Then I would rather go with probably maggots over a leech because
I don't know if I'd want to put maggots in my cow, especially if I was going to eat it.
Why are you putting leeches on your cow?
I don't know. I'm just saying.
You just want to put leeches on the animal.
I'm just saying that I want to see if there is a market for animals.
So let's say if your pet had diabetes and they look like they're walking on their paws was rough, you could probably put some leeches and that would help. Because we have seen somebody who their dog had diabetes. I thought they did. I'm like, oh, you don't take insulin? And they're like, no.
My dog.
Oh, and they're like, my dog does. And I'm like, how do you check your dog's blood sugar all day? Those things are like super and it was a small dog too, so very energetic.
Wow.
And so their metabolism's jacked. And it's like,
oh my gosh,
all that blood sugar they're using, how do you even control that?
Yeah, I have a friend whose dog has CHF and is on a whole host, I'm not joking, a whole host of medications. Super expensive to maintain this dog. And I'm like, wow, that's an investment. I would just throw a leech on it. See what happens.
Let's just see what happens. Just take a leech and start throwing it at your animals.
What? Oh, okay, here's one for you. My black lab is severely obese, and she's elderly, and she doesn't get around, and I'm pretty sure she has 10 forms of arthritis. Why could I not throw leeches on her?
It seems like you probably could.
Well, there you go, Scott. Just came up.
But how do you know it's because the leeches is kind of black? I mean, you're going to lose the leech.
Willing to try.
Let's give it a go.
I want to find some leeches.
All right, next episode we're bringing your dog in here and we're throwing some leeches at him.
I'm just like, I want to start a craze. Like, I want there to be now a black market for leeches for animals. Animal
leeching.
Yeah. That people would pick up on it. Like, let's just say it's,
I'm sure if we Googled animal leeching, it would probably come up.
When your sister had a leech on her, was it hard to get off?
That's what I was actually talking to Scott about. I remember it being hard to get off. In fact, I think we thought we had to do the same thing as you would like a slug. If I remember right, it was hard to get.
That is recommended.
Yeah, I think we put salt on it when we went home. And if I remember right, it wasn't just one, like it was several. And they weren't huge. They were little lake, ones. But yeah, I think we went home and had to put salt on it, and she cried the whole way home.
Well, and I also read that if you can get over the yuck factor, they will just, once they're done feeding, they'll fall off.
Yeah.
Isn't it like 20 to 45 minutes?
40 minutes is a typical feeding.
Yeah.
She didn't want to wait that long?
And we were young. Like, I actually look at it now
I would have freaked out.
Well, like, now I'm like, why did my mom even let us ride bikes to the lake by ourselves at that age? Like, I'm going to say we were like 9 and 11 or something.
That seems like a reasonable age.
Yeah. Like a long ways. We're talking.
Yeah,
like,
how long are we
miles?
talking? Yeah.
I'm talking several miles. Like, probably 3 miles. And probably...
Was CPS a thing back then?
No.
Did you guys know how to swim well?
I still don't know how to swim well.
Yeah.
Like, I'm a horrible swimmer.
And
I think my mom was at work. Like, I think we weren't even... I'm amazed we're still alive. I'm gonna call my sister. We're gonna have
Worst
to bond
case
over
scenario,
this.
the grocery budget gets a little bit less.
Yeah, apparently. It was a different time.
And you know what's kind of sad about leeching? So they used to be around everywhere. They used to be a thing, and now they're actually kind of endangered.
Oh,
The
leeches
habitat
are?
for leeches, for medicinal leeches, is lessening, and there is a country, and I can't remember which one it was now, but they actually have they're a protected animal.
Oh,
These
really?
medicinal
No
leeches.
wonder they're $200 for
Yeah.
20 of them.
I was thinking that you were getting ripped off on that. So I'm like, don't pay that.
Yeah.
Don't pay that.
Well, and it was funny. There was a hospital in Manchester, England, who
It seems like the medicinal ones, though, that they could regulate and
yeah.
reproduce at a, reasonable, like,
Well, I'm sure there are farms, like there's maggot farms out there, but like the naturally occurring
Oh,
medicinal leeches,
right.
their habitat's going away.
they're like redheads.
Yeah, redheads and blondes.
Yeah.
True redheads and blondes.
Yeah.
Yeah.
They're supposed to be
Recessive genes, but they're still kicking. It's exciting.
gone. So they do work.
They do work for certain things, yeah, and it's just those molecules in their saliva you're trying to get at, and there's a cool, robust set of studies where they're trying to create all of these same molecules just synthetically,
Yeah.
so you don't have to apply the leech. But
Oh, I see. Well, and you're not going to just go to the store and buy some. You're not going to go to a naturopath and have them thrown on, correct? This is probably...
I'm sure there's naturopaths out there who've got some leeches.
Really?
I've never been to one, but I guess. I mean, if you're a naturopath, why wouldn't you, right?
Do they have leeches at your spa?
No.
What
I
about
meant
those?
not
What
that
about
I-
those little fish that you
Oh.
hear?
I can't wait to go to one of those spas.
I would.
No,
I don't think I would
haven't.
like it.
Oh.
My feet are
I don't
ticklish.
think,
I don't
yeah,
think I
mine
would
are
like it.
too, but I'm gonna try it. Like, if I can't handle it, I won't do it anymore, but I want to try it.
Yeah, I've heard it's like your skin's like baby soft after. Like
Yeah.
it eats like all the dead calluses and stuff off your feet.
Well, sometimes you don't want that because you need the calluses. Like if you're a runner, you want the callus, or you're going to blister.
Not when you wear flip flops,
No.
sandals.
Well, I know somebody who recently went to get a pedicure, and the person tried to remove the callus, and she was like, "Don't do that." Are you
Yeah,
kidding me?
Yeah.
I've heard multiple
Yeah.
people say that.
No, it sucks.
In nail spas.
Yeah.
Yeah.
Huh.
I don't run like you
Yeah.
or other people, but I run, but
You don't get
Still
calluses on
want-
your feet?
I want them removed.
I
take
get them
care
on
of that
my. I
before
get
they
them on my
form.
hands, and I like them to stay on my hands
Yeah.
Yeah.
for pull-ups and stuff. Seriously, because when they go away, when they get really
Oh, yeah.
soft, and your hands tear.
Oh, yeah.
Shut up, April. It's true.
Sure.
It's a
They
legit
blistered.
problem. It's a legit problem.
Oh,
So-
I know when we trapeze.
Yeah. It's legit.
So anyway, so we know that they work for certain things, and
Yeah.
it looked like the FDA approved them in what, like 2015? Is that right?
No, I think it was sooner than that.
Was it?
Yeah. And I can't remember the day. I want to say 07 sticks in my head
Oh,
for
really?
some reason. Yeah, it was a lot sooner than 15.
Yeah.
But they've been around for a little while, especially
Maybe
for the
that's
amputation
just a lot of
stuff.
the articles I kept reading were like done in 15, so maybe that's when it got popular again.
Well, and there's been a huge study on that transient receptor protein, that vanilloid class, because that's a huge, with capsaicin, they were researching that one just because it
Right.
works so well for that osteoarthritis and things like that, and the leeches just seem to have that, and how that affects calcium channels and the calcium ions is kind of exciting for pain management, because then you don't have like addiction issues and things like that.
Right. Is there any negative effects to leeching?
You can die from it. So,
Oh,
like,
that sounds serious.
the Napoleon, like, there's a bunch of
Like, I'm glad you asked.
Shocking, but I have an answer for you.
Well, I just remember reading a lot of Napoleon's army were drinking water that was contaminated with these leeches, and they didn't know it, and so they were getting super anemic. And because the leeches, the oral pharyngeal leaching is a problem.
So they were getting
And-
leeches ingested, and the leeches were
Were attaching in their esophagus
Ew.
and in their back of their mouth, and just
before they got to the stomach and got killed with the
yes,
stomach acid.
correct.
Ew.
And so they get
Wouldn't
super
you
anemic.
feel that?
Actually, there was in Africa, in Kenya in like '86, there was this village who had some contaminated water, and 6 people came down with this oral pharyngeal leaching, and they all became anemic. One died. Just
So they're
because-
small, like the leeches are teeny tiny, maybe?
Well, leeches can be up to 16 inches long. They can be pretty long. Mostly they're like that 3-inch range.
But wouldn't they give way after 45 minutes? Like, didn't we say that they only feed for so long?
Well, apparently if there's enough of them, and it's
So after the leech feeds, does it not detach?
It should. That's what they're saying.
So
But
wouldn't they all feed? You get a little woozy. They go down your GI tract and die.
I guess if you get enough of them, because it's a known thing that.
Yeah, but how? Like, doesn't that seem like you'd just be slimy water with little?
But couldn't they just suction on for grip? Like, just hold on until they were ready to eat again? Cause
Probably they've got the two ones for
okay.
But it's been a known thing. I mean, Napoleon, it was known his army was dying of that, and then this one in '86, these people that came down with this anemia, and their symptoms were things like you would expect. Abnormal tickling in the back of their throat. There was one guy who
I've had a cough for like 3 months. Maybe I've got a leech problem.
There was one guy who actually suffocated because the leech got so big it cut off his airway.
Oh, God.
Oh my gosh.
Crazy.
How do you not see a leech, though, before
That's
you
what I'm
drink it?
thinking. Like,
Well, I guess if you're in an army back in 1700, like clean water really wasn't a thing back then. That's
have
actually
you seen Forrest Gump in the Vietnam scenes? It's pretty intense.
Yeah.
Dark and rainy. I would drink leeches in weather like that. I wouldn't even notice.
Well, yeah, and back then, I mean, water cleanliness wasn't really a thing.
Yeah.
You know,
Well, but you're talking about ingestion of leeches. So is there any negative side effects to leeching topically?
Well, the negative would be bleeding problems, right? Because you can bleed for up to 10 hours afterwards. But your doctor's not going to put a leech on you unless he knows about those issues. And really, it's small capillary bleeding. You're not losing that much volume anyway. But no, I mean, other than like being allergic to something or...
Can you be allergic to a leech?
I would imagine there's a molecule you could be allergic to, yeah. Anybody, your immune system can create B cells for almost
What about
any
bacteria?
protein.
Do they ever bring bacteria, bad bacteria? Because they're opening your skin, and if they have something...
Well, and that's where that
MRSA.
chromomyocetin or whatever that name is, the molecule, it's an antimicrobial because the leeches don't want the bacteria either, so they've got to survive, and so this stuff is in their saliva.
Oh.
You know, it's very antimicrobial, and that's the point. But I would imagine you could probably get, something from them. It's like anything else,
Leeches are awesome.
They seem like...
Well... So you're pro-leeching?
For certain things, absolutely. I know if I, amputate a finger, I'm probably going to get leeched. I don't know if you should leech the overly optimistic, but apparently that was a thing.
And do you think it's just common? Like if we just went to our local hospital and you cut your finger off with a saw, do you think that the surgeon would have leeches available?
I do believe Harborview does have leeching. I have seen that there.
Wow.
And maggots.
Would it work for burns? Burn patients?
Maggots or leeching?
I don't know. Both? Any?
Well, leeching, no. Maggots, maybe.
I just think about like skin grafts and stuff. Would that be beneficial?
Oh yeah, the skin grafts for the burns, yeah, for sure.
I like how he's so confident with his nose, and then I give him some explanation. He's like, "Oh, okay, well, yeah, that perhaps."
Well, I was just thinking of like the dehydration and burns.
No, I'm talking about like skin grafts and treatments
no.
for long periods. I'm thinking, would leeching work for somebody who's had a skin graft?
Well, yeah, no, that's what they use them for, is skin graft.
Oh, well, silly me.
I
feel like
more
we need to fight
emergency.
today. Like, Scott, I just need to wrestle and get it over with.
Put a glass of wine and everybody gets a little aggressive.
Jeez.
But no, skin grafts is the number one, but I was thinking more emergency burns.
Oh, okay.
Not-
Yeah, no, I was thinking long-term treatment.
Gotcha.
There
See,
you
so
go.
we were saying the same thing.
Nah, but
no
not
need to fight.
at all.
That's it, we're fighting.
Oh, well, good. Well, if you liked what you saw or heard today, check us out on YouTube or our podcast.
Or visit our website, medicalconfessions.com.